Now let's take a closer look at the features of Heelift and Heelift Smooth and review the proper way to fit the product. Before you begin using the Heelift suspension boot, we recommend you read the instructions. The instructions very clearly demonstrate all the features we're about to review. The primary function of the Heelift suspension boot is the elevation of the heel and complete elimination of all pressure so that the heel is suspended in air. A primary feature of the Heelift suspension boot is the fixed pad, which is designed to stay in place unless for a specific reason it needs to be modified. As you can see, with the calf taking the pressure from the heel, there is complete heel pressure elimination. The Heelift suspension boot comes in two forms, identical except for the type of foam. The smooth boot is designed for patients who have considerable edema and swelling of the lower extremity, such that the use of the convoluted foam could cause dimpling or indentations in the leg. The benefit of the convoluted foam is the increased ventilation that it allows. It is therefore a somewhat cooler boot than the smooth boot. The application and fitting of the Heelift suspension boot is an easy and efficient process. The fitting is simplified because one size fits all. Start by opening the boot and removing the spare pad. Next, lift the leg and place the heel deep within the boot so that the foot is held in neutral dorsiflexion. The flaps are then closed, leaving some space between them for ventilation. The new single strap closure on each side further simplifies the fitting process, allowing you to make sure that the heel is in the proper position while tightening the strap. The straps should not touch the leg. However, the back of the straps is a very smooth Dacron that will not cause skin irritation should the straps make contact with the skin. There is a tag on the boot facing the caregiver. It reads, "Please remove the boot and examine the leg every 8 hours." Even though the leg stays in a good position for a long period of time, it is still important to check the leg regularly. To check for proper fit, reach into the gap under the heel to make certain the heel is not touching the bed. Even when the patient moves her leg back and forth on the bed, the heel does not touch the bed sheets. There is complete pressure elimination. With the patient's foot completely relaxed, the foot is held at a 90-degree angle. The patient can push her foot forward, and when she relaxes the foot, the boot returns the foot to the neutral position. The patient can slide her leg freely from side to side or up and down, thanks to the low-friction tricot backing on the back of the boot. The tricot backing allows free motion by the patient to help avoid deep vein thrombosis, as well as to avoid frequent adjustments by the nurse, because the foot remains fixed within the boot, keeping the heel properly suspended. Each boot comes with a spare pad. Note the message on the pad: "Do not throw me away, you might need me someday." The spare pad can be utilized in a number of ways. If there is a problem with external rotation, simply remove the protective adhesive paper and affix the spare pad to the side of the boot. This effectively eliminates the possibility of hip rotation. Should the patient have a problem with a heel cord contracture, the spare pad can be placed between the forefoot and the front of the boot. In this case, remove only the backing paper that will be used to adhere the pad to the boot, and leave the backing paper on the upper part of the pad so that the pad will not stick to the sheets. Slide the boot back on the leg, pull the straps taut, and now there is additional control for protection against heel cord contracture and subsequent foot drop. The patient can still push down and relax, and the boot will spring the foot back to a 90-degree angle once again. For patients of a bariatric size with large, heavy legs, the spare pad may be placed on top of the fixed pad. Again, the heel is placed deep within the boot and the straps applied. Note that even in this situation, there is room between the straps and the legs. For very tall patients, where you need to distribute the pressure over a much longer area, position the pad away from the heel of the boot. The three major areas of concern on the lower leg are the heel, which is the prime area where ulcerations occur, and the medial and the lateral malleoli. When properly fitted, Heelift suspension boot allows full motion of the ankle while not allowing pressure on the heel or either malleolus from the device. In those cases where a patient develops redness of the Achilles tendon area, there are three options. One would be to cut a large V or U out of the fixed pad. Another option would be to cut off the end of the pad. And a third option would be to cut a V or U area from the spare pad. It is not too difficult to immobilize the distal few inches from the fixed pad and then to remove that segment. Then the leg can be repositioned back into the boot, where it is now apparent that the entire area around the Achilles tendon has been relieved of any pressure. The alternative is to cut a V or U from the spare pad, remove the paper backing, and apply the pad so that the patient again has complete relief around the Achilles tendon. Walking short distances while wearing the boot is permitted. However, walking longer distances should be done only with the assistance of a caregiver. If a patient requires the use of sequential compression devices or SCDs to prevent deep vein thrombosis, the design of the boot allows easy exit for the power tubing. The boot can be applied and the straps adjusted carefully to accommodate inflation-deflation without disturbing the device. If a patient is using a foot pump device to prevent deep vein thrombosis, the cleft in the boot can be used as an exit port for the tubing portion of the device. The opposite side of the boot can also work very well for exiting the tubing on the other foot. In the case of either sequential compression devices or foot pumps, Heelift enables the patient to maintain mobility without adverse effects to the heel or the devices. Note: the Heelift is designed for single patient use. It can be easily machine washed and dried by removing the spare pad, closing the straps, and placing the boot in a net laundry bag.